Dando sequência aos trabalhos, gostaríamos de convidar agora para a mesa dupla com o tema O que estudos com crianças não alfabetizadas e adultos analfabetos nos dizem sobre a dislexia, com a doutora Ghislaine Dehaene-Lambertz, do Institut National de la Santé et de la Recherche Médicale, INSERM, da França, e a doutora Regine Kolinski, da Université Libre de Bruxelas, da Bélgica. Vamos à nossa mesa dupla.
Boa tarde. Antes de fazer switch para inglês, queria só agradecer muito, em nome de ambas, aliás, pelo convite. E eu acho melhor agora fazer switch logo, já que a gente está muito atrasada. A Ghislaine vai falar primeiro do desenvolvimento e depois vou seguir com estudos com adultos analfabetos. So, por favor.
So, I am smaller. So, as you have seen already in several presentations, learning to read is to create a visual representation specific of the learned script within an already developed visual system, and to connect this new representation to the existing language network. And as you can imagine, when you are 5 or 6 or 7 and you are going for the first time to school, and for the first time we ask to the child to read, is already very well developed and he knows how to speak, and he has seen a lot of things. So what I will present today is how reading is facilitated by the pre-existing brain organization, and how reading also modifies these pre-existing networks while the child is becoming able to decipher words and to consciously manipulate the phonetic level of speech. So it's why it's very difficult to compare after that dyslexic children with normal readers, because in fact reading will change the brain organization. So you will never know, at least with brain imaging, what the difference you are seeing are related to the causes of dyslexia or to the consequences of not being able to read. So if we go back a little bit to the brain in adults, when adults are listening to speech, they activate a very large region in the brain, and you see here the peak of activation in a meta-analysis study, and you see all this peak mainly around the frontal areas and here, and the temporal areas. But which regions are important here to learn to read? So I think the first important region, and Joe spoke about a lot about what these regions are doing, are the posterior temporal regions that you see here. Sorry, I have problem with my button. Here, where the phonetic representation of the native language are stored. A second important type of region is the loops that you have with, between the parietal region and the frontal region, which helps you to maintain in your verbal memory a sequence of sounds. So, for example, when you are just memorizing a telephone number, or when you are trying to say that, for example, bateau in French is B-A-T, and you are obliged to keep all this corresponding phoneme, grapheme correspondence in your verbal memory before being able to read automatically this sequence of letters. The last part of this region, which is important, are the regions that integrate the different aspects of speech. Because we always speak about speech as an auditory stimulus, but it's not true. You are looking to me, you are a little far from me, but you see that I have visual movement that are related to what I am saying. So you have a visual component of speech, and because you are trying to imitate me, for example, you have also a motor component of speech. And these different auditory, motor, and visual components are integrated in a very important region. For example, here, the posterior superior temporal sulcus, but also in the frontal regions. And you will need that also when you learn to read, because the child usually look at you when you are doing b, and try to imitate and try to put correspondence between what you are doing, what he's trying to do, and what the sound which is coming out. All this system is developed very early on. I just want to go very fast across studies in babies, and you will see that, for example, 2-month-old babies listening to their native language already activate a large part of these regions. You see here in 2 experiments. And when you look at all these fiber tracks that Frank was speaking about, they are already present very early on, even in the fetus. Furthermore, if you think to this verbal memory, we have evidence that already babies, 2-month-old babies, are using the same type of frontoparietal loop to remember, for example, a sentence. Not really the word of a sentence, but maybe the melody of the sentence. And you see here an experiment in which we have presented a sentence to 2-month-old babies, and this sentence was repeated, and it's in this frontal region you have an increase of activity when the sentence was repeated. And you have also a maturation which is correlated between these 3 regions, so the frontal region in which you program, you plan the motor sequence, the posterior temporal region in which you store the sound, and the arcuate fasciculus, which is the tracks which relate these 2 regions. So all these 3 components are maturing together, showing that they are working already together very early on. If we go now to the infant's phonetic representation, in fact, infants are very early on able to discriminate syllables. So, for example, if you present trials in which you repeat the syllable like ba, 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 and after that, other trials in which you have a change, ba, 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 ga, or ga, 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 ba here, and you look at the difference between that type of trials, the match and the mismatch trial, and you record with this electrode on the head of the baby, you have a very mismatched response around 400 milliseconds. And this response is categorical, so it's bigger when you cross a phonetic boundary than when you stay within the boundary. Furthermore, if you do now something more complicated, like ba, bon, baby, and you compare this type of trial to trials in which you change the consonant, ga, gen, ge, bi, you got exactly the same type of response. So they are already able to go to the level, at least implicitly, to the level of the consonant, even when there is a change of vowel in these syllables. We were speaking about the correspondence between visual movement and sound. So here we presented to babies a face which was making either a R shape, so R like that, but with no sound, or E. And after that, the face disappeared and the baby listened to R or E. And again, when you compare the trials in which there was a mismatch between the sound and the visual face which was presented before, you have also the same type of mismatch response. So babies are already able to integrate the visual articulatory component and the auditory component. So to summarize, so you have seen that in babies. So imagine how it is in 5-year-olds. So they possess, when they arrive at the age of reading acquisition, already a very organized language system, able to represent the phonemes used by their native language, to categorize them even in different vocalic contexts, to integrate auditory, visual, and the motor components of speech, and that from infanthood, and using the same neural circuits than in adults. So now if we look at the visual system, it's already developed. So you have two systems here. You have a dorsal pathway, and I will not speak about it, but it's very important, especially for attention and attention to the left to right writing of the letter in the word. But I will not speak about it. But about this system, the ventral pathway, where in adults you have a very nice mosaic of visual of response to different visual objects. And you can see here, and Frank presented already this type of picture, the response to houses, and after that the response to face, and after that the response to tools, and the response to words is coming here between the tools and the faces. So all the other response, so a 5-year-old had already seen faces, has already seen houses, faces, or tools, but now he has to decipher what means this type of visual signs. And he will have to create this response, this specific response to the words here. So what we know from the literature is indeed you can find the same visual mosaic in very young children, for example, here in 5 to 8-year-old. And you have already the response to the houses and to the tools. And it's, in fact, it doesn't change with age. Enfin, for today, we will say it doesn't change. You have also the same response for the landscape across ages. But what is very interesting is that the response to face in this first study seems to appear quite late in this region, which is a region, so face will appear mainly on the right side, and on the other side you have the response to the words, in the same type of region, which is the fusiform gyrus. So their visual system is specialized for visual categories as described in adults, for example, except for weak response to faces in the fusiform region at the age of 5. So with that, we did an experiment in 4 groups of children, one age 6-year-old children, in which we had 13 readers and 13 non-readers, because we take advantage of the fact that the civil and the academic year are not aligned. So you can have the same age, but some will be already in the first school age, in the first year of school, while the others will remain in the kindergarten. So you see they have the same age. And here you have 10-year-old, 9, 10-year-old, and some were readers and some were dyslexic. And you see here the difference of words read in 1 minute for the different groups. And they first went in a neural language experiment in which they have to listen to short sentence in French or Japanese, which was not understood by the children, and the sentence was repeated 1 time. The task was very indirect because they have just to press at the end of the sentence. As you can see here, if you look just at the network of regions responding more to the native language than to a foreign language, there is no big difference across 6-year-old and 10-year-old, and even between dyslexic and normal readers. But in fact, in this system, you have differences related to reading. For example, if we look at the difference between the dyslexic and the normal readers, the old ones, so the 10-year-old, you can see that there was an increase for the first presentation of the French sentence. So here you see how the activation is larger for the first presentation of the sentence than the second presentation, and larger than for the foreign language. And it was present only in readers, so you have 2 groups of readers here, and the other groups are the dyslexic. So they were also separated by the socioeconomic background, but so you have 2 groups of dyslexic and 2 groups of normal readers. But you see here that systematically the normal readers are the green and the blue lines, they are above largely above the red and cyan line, which are the dyslexic readers, the dyslexic children. So this increase was in three important regions. The first one is the posterior superior temporal region, so the regions which host the phonological representation of the native language and the integration between auditory and visual components of speech. The second increase was in the basal language area, which is an area involved in the semantic of the language. And the third increase was in a region which is normally a visual region, which is a visual word form area. So which was recruited here by the normal readers while they were listening to speech within the noise of the scanner. If now you look at the younger children, so now the non-readers are in blue, and you see that the non-readers, the 6 years non-readers, are flat. They have no more this increase for the first presentation of the sentence in their native language. But when you are readers, and especially you have the same age between the blue and the green line, but now you are readers, you have an increase in this region, in this phonological region, also in the basal language area, but nothing here. Here you have only the most advanced reader which have this increase of activation. So to summarize what we got is that reading acquisition improved phonological representation of the native language in this posterior temporal region and as early as the first year of school. And it provides children with a new orthographic representation that can be automatically recruited here in the noise of the scanner MRI. As you know, the MRI is making a lot of noise. So in that case, the most expert reader can recruit this visual word form and this orthographic representation. And as you have seen here, this is not stabilized. It's evolved during these 3 years of reading acquisition. But these changes are absent in dyslexic, will remain similar to non-readers. So we do not know how. So now, if you are just comparing the normal readers and the dyslexics, you see this difference. You do not know whether they are because they have trouble in all of these regions, or just because they are not able to read, so they cannot benefit from these changes. So now if we look at the visual paradigm. So the same children were looking to faces, houses, French words, and checkerboards, and their task was just to press a key when there was a star, so also a very indirect task. And you remember what we presented before, so that's the visual mosaic that we see in adults, and in the 9, 10-year-olds, you get exactly the same thing, and as Frank presented it before, so the checkerboard, in science, the houses and landscape in yellow, the faces, and after that, the words. If you look at non-readers, you have no words response, because they have not learned to read. But what is funny too is that you have also no face response, like it was already described in the literature, which is quite surprising because at 5 years they know a lot of things about faces. They recognize a lot of people. So it's very surprising, and we have difficulty to understand what is really happening here. But it's an interesting fact that the fusiform region, which is a region which hosts both the face representation and the word representation, seems to develop between the 6 and the 9 years of age. So it may be because we have this plasticity of this region at this age that all the culture have things that 6-year-old may be a good age to teach reading. So now more specifically, if we look at the response to words, so you see here the response for the 6-year-old non-reader, so nothing. The visual word form area, which appears here in the 10-year-old, and what you got in the 6-year-old, which are readers, who are readers. So if you compare all this response, you can see first that the visual word form is activated now by visual words, Before it was by auditory words, but now here it's visual words, already in the, after 1 year of reading. And that you have a stronger involvement of the language system in the young readers relatively to the others, in which reading is more automatic now. And you have here the regions which are correlated with the number of words read by minutes, and you see again the visual word form area and the posterior superior temporal region. It's not only that you have an increase of activation in the visual word form area, in this visual, in this part of the visual system, you have also an extension of this response to words. So if you look here at the front of this red spot, you see that both the 6-year-old and the 9-year-old have a strong response to words relatively to the other category, but none the dyslexic nor the non-readers. But if you go now more back in the head, you have only a response specific to word for the 9-year-old, nothing for the 6-year-old, which are in green. And if you go back, here you see nothing at all, but in adults you will still see a response to words in this very backward position. So you will have a development also in the size of this specific response to words. For the face response, you have a little bit the same. You have a strong response to faces in the readers all along this posterior region, specifically for words relatively to the other categories. And if now you look, it was on the right side because faces are well represented on the right side of the brain. But if you go in the left side, you have now a competition between words and faces to occupy the same spot in the region of the fusiform gyrus. And you can see here, for example, that all in this region you have strong response to words, but also to faces. They have almost the same level. And here you see perfectly that the readers have a stronger response, as you can see here, for words relatively to faces, but the non-readers, that is the dyslexic and the 6-year-old in kindergarten, have a stronger response to faces than to words. So there is really a competition between these two very important stimuli in the same brain areas. So this competition will give you funny differences. So, for example, in adults, when you will expect that if you present faces to adults, you will have stronger activation on the right side, and you got it in the 10 years normal readers. They have stronger activation in the right hemisphere than in the left. But you will have also it in the 6-year-old, but nothing for the non-readers, but they have no response to faces, but also nothing for the dyslexic. So the dyslexic have the same response on the left and on the right. And the question is that, do they have a problem here, or just because they do not have competition here with words, so the response to face is established. So it's not a deficit or a trouble of lateralization towards the right side, it's because here there is no competition with words in the left fusiform response. So just to finish, I have to summarize first the visual part. So learning to read deeply affects the organization of the ventral visual area. You will have a new representation, which is cultural, because it will be sensitive to different scripts depending on your language, which develop from the anterior and to the posterior region, and whose activity depends on the fluency and automaticity of the recognition of the letter sequence. This response is in competition with the response to faces. And you have, with reading, two things. So decrease of response, competition on the left, but also an increase of the response to faces on the right. And we do not understand very well what is happening here. And so the difference with the dyslexic is important both for words and for the face representation. So I hope you you will know now that children, and so you will know, you know that before, in fact, already possess a well-developed spoken language and visual system before learning to read. But reading acquisition take advantage of this previous organization and rapidly transforms this network. So it refines the oral speech system, improving the cross-modal integration, refining the phonological representation of the native language. And it's that already after 1 year of reading acquisition, so it goes very fast. But the recruitment of the visual word form area take more time, but give a new representation that can help readers. For example, in aversive conditions, they will have more brain area which can help to understand what speech perception when you are in a noisy condition, when you are readers and when you are non-readers. The visual system also is modified, and so dyslexic do not benefit of these changes, as they never reach the reading fluency, at least when we compare them to the normal readers. We choose dyslexic who are not at the good level. And in all these experiments, they have remained with similar activations than non-readers. So my final conclusion is like a little bit with Frank's conclusion, is that it's, brain imaging is a very interesting tool to understand the mechanism of reading, but it's very difficult without theory to know what is causes or consequences of the difference we see in activation between dyslexic and normal readers. Thank you.